have with us Dr. Sheryl Roe, who's a certified acupuncturist and also has a diplomat in Chinese herbology, which I think we'll find interesting. Sheryl is probably the true representative of integrated medicine. Not only is she an acupuncturist, but she's also a registered nurse. The combination of the two is really quite good because she knows when you put those needles in, she's familiar with also putting needles into your arm, every other place that you can possibly imagine. But she's going to go over a lot of the things that acupuncture will do and talk to you about how she got into acupuncture. And we're really interested in hearing this, especially from the, you also are a diplomat in Chinese herbology and acupuncture and also with the American Academy of Pain Management.
Right.
Is that right?
Right. Well, I'm certified in the American Academy of Pain Management in Western medicine. So I'm certified in Western medicine, pain, and acupuncture.
Both.
So, both.
And you're from Texas.
I'm from Texas.
So we'll have a Texas accent.
Yeah.
I caught her license plate out there and I said, where are you from? And I saw you see a Texas license because I spent most of my life in San Antonio. Whenever I see one out.
As Jerry said, I've been a registered nurse for almost 25 years. I have extensive, I actually started out my practice taking care of AIDS patients back in the late 80s. And I don't know how much y'all know about that back then. It was not the chronic condition it is today. In fact, from diagnosis to death, at that point for men was a year and for women was 9 months. So most everyone that I took care of came in, looked fine, and was dead before. I mean, they didn't lose weight and do all those things. I was lucky enough to work at a private research hospital where we really did get to do the things that is the reason why AIDS is a chronic condition today. Did we get it?
Well, it was on. Yeah, it looks like it's on now. Now I think you have to work it with your computer here, which I'm not sure how you do.
Oh. Do you know? Cool.
The expert.
That's what we need. Anyhow, so I did that for 10 years, and the bad news is everybody I took care of died. Everybody. There were no survivors. So I thought, I really don't want to do this anymore. So I decided I know a lot about drugs, so I'll go do chemo. Well, the truth is there were still people that died, so I couldn't do that either. And at the time, I was working in this outpatient department, and there were these 2 doctors who were trying to do pain procedures in the outpatient department. So I began to help them, mostly because nobody else wanted to. Is it working? No?
It's coming.
Okay, cool. But anyhow, so I started doing pain management. The good thing about pain management is it's really hard to kill pain patients. You give them lots of drugs, they never die. So I enjoyed that a lot. The downside is as we progressed, there was a group of people who began to get this diagnosis for this condition that now we recognize as fibromyalgia. Back then, if they got a diagnosis of fibromyalgia, it was close to having a diagnosis of AIDS. No one wanted to take care of them. No one. No one wanted to see them. My doctors said, oh, well, they're all women. They just want drugs. There's nothing we can do for them. And besides, we can't make any money. So I, as the gatekeeper, would have to turn these people away. And it was terrible. I was out in the country, and these people would call me and beg me and tell me they'd seen, they'd show up at the doctor's office and say, I got fibromyalgia. And the doctor would say, well, you just have to leave. I can't help you. So I was looking for something to offer them. And like I said, I'm from Texas. I live south of Houston. So in Houston, there's a huge fibromyalgia society, even back then. So I went to one of the meetings. And the meeting that particular night, there was a little Chinese man. I mean, he wasn't even as big as me. And he got up there, and when I first sat down, I thought, man, I can't understand anything he's saying. But he had a cadence. So as you began to listen, you could understand what he was saying. And it was really, really fascinating. So after the talk, I went up to him and said, I want to know more about this. I want to know how I can offer this to all these poor women. And he said, I just opened a school, and if you'll come to my school, I'll teach you. So I went the next day, and sure enough, him and his wife had opened this school in Houston, and this was the second class through the school. There were 6 of us. There were 2 MDs, there were 2 RNs, there was an electrical engineer, some other guy, but he never made it. Anyhow, we were the second class that went through the school. Today that school is the second, well, there's only 2 schools in Texas, and he graduates about 1,500 students a semester, so it's a much, much bigger school now. But back then, I was really, really lucky because he couldn't afford any teachers. So he got all of his friends who did acupuncture to come teach at the school. So I got a different perspective because these people would work in their clinic all day and then come to the school and teach. And it really helped for me because I was able to correlate that. And again, I'm still working full-time at the pain clinic, so I was able to correlate the Western medicine and our procedures and how that worked with acupuncture. So it gave me a better perspective than I think I would have gotten if I'd have just gone through school.
Is there a way to set the computer for this?
There's my glasses on. Where's the picture? Normally that's what does it. It's not looking good, is it? Okay, do you know how to do it from here?
Not really. Minimize that.
Yeah, and then go in there someplace. I think if you go to start and go to settings.
Okay, start.
And then control panel, settings, control panel. And then I think in there's a place that's for looking at it. Well, the good news is I can do this without this. It'll just go a little slower. There's a few things that I wanted to talk about. Primarily, I want to talk about why acupuncture works, how it works, what the benefits are. And the basic premise is that energy flows through your body, separate from your nervous system, separate from your circulatory system. Now, of course, your body's just not big enough for that to be going on without those interacting. But what the Chinese did, and again, you got to remember, this was 3,000 years ago, really, really had lots and lots of time. And as you read the books, they really had a lot of time. So they spent a lot of time, and what was significant about that was at that point in history, they were not allowed to do human dissection. You could not be cutting up ancestors. So their observations about how our body worked were all based on external observations. Now, they could cut up animals, so they kind of sort of knew, but they couldn't be cutting up people, so they had to guess. And so as they did these observations to try to figure out how this energy flowed and how it correlated with different organs and how those organs worked. Now, what's interesting is their perception of how the organs work and how we know they work are not exactly the same. But what's significant is what they perceive that these different channels or our energy flows worked, how they worked, were indeed correct. So one of the channels, and the channels are all named after the organ that either affected them the most or was affected by it. So there's a lung channel, there's a liver channel, there's a gallbladder channel. And it's kind of interesting because gallbladder is one of the most significant channels in the entire body. But if you don't have a gallbladder, that does not mean that that channel doesn't work, and it doesn't mean that that energy's not there. So that's what I'm saying about it being a little different. Now what they did is once they ascertained that this energy was flowing through your body, and they began to quite literally get people down, stick pins in them and write down what happened, they began to discover that the energy would flow in and out of the body. So it would flow in and touch organs, flow back out to the surface. So they drew pictures of where it flowed on the outside of the body, and then they began to literally locate points. And I have to tell you, in my mind, the way I see it, and the way they describe it is like a water. Now, Western medicine can actually see this energy, but they see it as electricity. and their perception is that you can't affect the electricity. Whereas the Chinese model is that it's water. So the center of our body is the ocean. And we feed the ocean feeds us, and then that energy flows out from the ocean to rivers and streams and springs to wells. And it's pretty interesting. Wells are considered the tips of the fingers and toes, and they are significant for treating mental illness. So when you're trying to treat someone who has significant mental illness, rather than affect the flow, we're going to try to pull that from the depths of the well to help them. So it's just a different perspective. And again, as the energy flows, the goal with the needle placement is to affect that flow. Now there's a really, really famous book, which is on my PowerPoint slide, and the name of it's Nanjing, and it's supposed to be the original book of medicine in China. And it's, as with all things in China, it's not very straightforward. There was the book is based on the premise that there was an emperor whose name was Huangdi, which translates to Yellow Emperor. Apparently there really was no emperor whose real name was Huangdi, but the whole book is a question and answer book. So Huangdi, the emperor, would ask this doctor what about these things, and he would answer. And that was the basis for the original medical book in China. So Huangdi said, well, what causes pain? And the doctor said, anytime energy does not flow, you have pain. So that was the answer to that question. So the basis for treating pain in acupuncture is to figure out where the flow is clogged up, why it's clogged up, and unclog it. So it's pretty still no luck, huh?
No, it's not coordinating between the computer and the up there for some reason.
Nothing, huh? Oh yeah, if you had other
No
inputs.
signal.
Is there another place to plug it in?
No, this is about it. That's the only report, I think.
Yeah. Sorry. So, in an effort to understand how this energy flow exists and how it interacts with the organs, there's actually three basic schools of thought. The most basic is called Yin Yang. And I have a picture of the YinYang symbol, but y'all have kind of seen that, where the black into the white into the black. The whole idea behind that symbol is that you have to have balance. You can't have one without the other. If you have too much of one, you have not enough of the other. So one of the goals for Chinese medicine is to try to get you back in balance. Western medicine has a term for that too. It's called homeostasis. And the premise behind homeostasis is that your body is always trying to get back to its best normal. Chinese medicine, Yin Yang, is the premise that your body is always trying to get back to normal, but that you have this amount of essence that you never lose. Sometimes all of it's one way, sometimes part of it's one way. And so the goal is to try to even that out. Now, another school of thought is that our relationship with the elements in the world. And the Chinese believed that there were 5 elements that existed in the universe, in the world, and inside each one of us. And those 5 elements were fire, earth, metal, water, and wood. They then associated those different elements with different organs. So wood is liver and gallbladder. Water is kidney and bladder. Metal is lung, large intestine. Earth is spleen and stomach. What did I forget? Oh, fire. Fire is heart and small intestine. Now, if you think about that, these organs that I'm talking about, one's a solid organ, one's a hollow organ. The Chinese called that internal and external, because they've seen the solid organ as an internal organ and the hollow organ as actually a source from the outside, but that they work together. and then they associated with these different elements. Then they associated a specific emotion with each one of these elements. So one of the, and again I had a picture of this, these elements all kind of work together. So let's say wood. In order to have wood, you have to have water. So water supports wood. Wood, of course, supports fire. Fire supports earth. Earth supports metal. Metal holds water. Water supports. So that's the system. Now, left to their own devices, they would just keep getting bigger and bigger and bigger. So there's a control. Of course, water controls fire. Fire controls metal. Metal controls wood. Wood controls earth. And earth controls water. Can you kind of visualize that? I know it's hard. Like I said, I got a picture. But, so, an example, wood controls earth. Wood is liver and gallbladder. Liver is where we store our anger. Gallbladder is where we store our frustration. So if you were a person who was angry and frustrated all the time, eventually that wood would attack earth, which is spleen and stomach, and you would get ulcers. Now, Western medicine, who doesn't see it from that perspective, would treat those ulcers. And in many cases, people take medicine for ulcers forever. It never goes away. In Chinese medicine, we would not treat those ulcers. We would go back and treat the anger, because once the anger went away, the ulcers would too. So it's a different perspective. So that is, you know, the other school of thought. Then again, the school of thought about the channels and how they flow through the body and how they affect the different organs. So those are the three main schools of thought about how you figure out what's going on with somebody. Now, I brought some pictures. When the Chinese wrote these books, they did not have, they didn't have any equipment for doing this sort of thing. So they had to do it by observation. And one of the things, one of the things that they discovered was, which I'm going to have you all doing this to each other for long, is that by looking at your tongue, I can tell whether you slept last night. I can tell if you're mad at your husband. I can tell what you ate yesterday. And I can tell whether you've been drinking coffee all morning. So I was going to pass this around so everybody could see. I'll start here. I used to work at the University of Texas Medical Branch in Galveston. Huge teaching hospital. And as I went to school, and you know, of course, I'm practicing on the med students and everybody when I'm learning this, people would walk up to me in the hallway and stick their tongue out. So that's one method of diagnosis. Now, the other method of diagnosis, and again, this is based on, you know, thousands of years ago. And ladies, you'll love this. When they wrote all these books, this was all men writing books about men. Okay? Their attitude was, your woman was broke, throw her away, get a new one, they're not worth fixing. And they really did. They wrote for thousands of years and never addressed any women's issues at all because they didn't think we needed to be fixed. You just throw them away. So there turned out there was this emperor who really liked one of his women, and he decided he wanted to get her fixed. So at that time in China, and my understanding is it's still pretty much like that, that physicians are only paid when their patients are well. So it's a different motivation than what we have here. So this doctor was very motivated to fix this woman, but it was also a period of time when men weren't allowed to look at other men's women. So this doctor was having some difficulty, but he really wanted to fix her because otherwise he wasn't going to get paid. So he went to the emperor and said, listen, I know I'm not supposed to be looking at her, but if you can just let me see some part of her, I think I could figure this out. So the emperor said, fine. You can look at her from here down. But you need to figure out what's the matter with her, and you need to fix her because I'm going to chop your head off if you don't. So they developed what they call Chinese x-ray, which is a method of pulse taking that everything I didn't find out by looking at your tongue, I will now know. This will tell me if you're angry. This will tell me if you're lying. It'll tell me if you're afraid. So it's a pretty interesting method of diagnosis. In Chinese medicine, it works really well because that tells me about you individually. And one of the important things about Chinese medicine is there are no generic diagnoses. There's no pneumonia, there's no congestive heart failure, because every diagnosis is specific for each person. So if 3 of you came to me and said, I just went to the doctor and he said I have pneumonia, will you treat me? I would not be able to treat you the same, because you might have a cough and be coughing up yellow stuff and running a fever. You might be sitting around shivering and you're just freezing to death, and you may just feel like you just can't get up, you just can't move. Those would be 3 entirely different diagnoses, which would be treated entirely different for each one of you. That's one of the big things about Chinese medicine. Now, as Jerry was saying, I am a diplomat in both acupuncture and herbology. And like I said, I have a significant history in drugs. So I have a clear understanding of how those all go together. I don't prescribe a lot of herbs. I have found that, unfortunately, a lot of people come see me already taking drugs. But truthfully, the best solution, and in China, they really don't pass out herbs like we do drugs. It's about balance. So one of the things that we talked about when I was in school was, in China, you get up in the morning and you say, well, I feel like this today, so I need to eat this and this so that that will either support that or fix it. And so you would eat your whatever you ate that day according to how you felt. Now the truth is in America, we have no idea how food makes us feel. We don't know. We watch TV, they say you need pizza, we stuff some pizza in our face. 3 hours later we're burping and our stomach's killing us, and we say, I don't know what caused that. You know, we don't have any relationship with our body and food. So I make a lot of recommendations for dietary changes. Those are kind of things that are within our control. They make a huge difference in how you feel. But you have to figure out what it is that makes you feel that way. When I was going to school, one of the things they talked about is in China they eat virtually no dairy products whatsoever. They use a lot of soy, but they just don't eat dairy products. The premise is we're not baby cows, we don't need dairy products. So when I was going to school, I said, well, I don't eat that much dairy products, but I don't think it affects me. And they said, okay, go without it. So I went for 2 weeks, and I didn't eat any, which I normally don't eat ice cream or drink milk, but I like cheese, sour cream, that sort of stuff. So I didn't eat any. At the end of the 2 weeks, I said, okay, I feel fine. I said, okay, have some. So I did. I had some cheese. Almost immediately, my stomach began to hurt. I noticed I had constipation. I had cramps, things that I had never associated with food that clearly were being caused. And so today, are we getting closer?
We got everything working.
Okay, this was my plan, but we've kind of drifted off of that, so I'm going to try to catch up with myself. I have a story similar to Jerry's that I want to talk about. In 1972, Richard Nixon went to China, and that was considered, he was considered the person who opened up China for the U.S. And it was pretty interesting. There was a guy that went with him, James Reston, who had to have an emergency appendectomy. When he came back, he worked for the New York Times, and when he came back, he wrote a story. And that's considered the very first story about acupuncture that was, you know, nationally published. And I've read that story. It's pretty, it's so cool. As you can imagine, Reston went with the president. They had an entourage. They had translators. And he began to have this severe pain to such a degree and a high fever, so they load him up. They take him to the hospital where there's no one that speaks English, and the translator leaves. So Mr. Reston is taken into this room, laid out on this table, and he said, you know, everybody's standing around talking Chinese, and he's scared to death, and he's having all this terrible pain. And all the time this is going on, there's somebody pulling on his ear really hard. And he said, I just couldn't get my head turned around to see the guy. And he said, so they put up this this thing, so I can't really see what they're doing. But he said, I can feel them touching my stomach. And he said, I am so scared. And he said, all the time they're doing this, there's a guy pulling on my ear. And he said, they're just talking to each other. And he said, and I just know I'm going to be dead. I'm going to die here. He said, in a little bit, they pull the drapes off of me. And he said, I've got stitches in my stomach. He said, and they roll a wheelchair up and indicate I should get off the table and get in he said, I was so scared. He said, and I just know I can't get off that table. And he said, sure enough, I stand up. They put me in the wheelchair. They roll me into this room, get me out, and bring me food. And he said, I kept saying, I just had surgery. I can't eat. They insisted that he eat. So he ate. They come back in, brought his clothes in. Wanted to put his clothes on. He said, but I just had surgery. It was like 30 minutes ago. They were very adamant. He put his clothes on. He put his clothes on. They put him back in the wheelchair, put him in the car, and sent him back to his hotel. He said, so I go in there and I tell the translator, am I going to die? Am I going to die? And the translator said, oh, no. He said, they took your appendix out. You're fine. He said, but I didn't get any anesthesia. And the translator said, we don't have anesthesia here. Because it's very expensive and it has no value. People die from anesthesia, which is true. People die in this country every day from anesthesia. If you've ever had surgery, after you have surgery, you can't eat anything, you're nauseated, you're sick for 2 days. That's all from the anesthesia. If you don't have anesthesia, you don't have those problems. So that's exactly what happened to him. He went in, he had his appendix removed, he went back to the hotel. When he got back to the U.S., of course, every doctor he knew came and looked at him and told him that they had done fine. It was a good surgery. He was fine. He didn't have any problems at all. So he wrote that article, was really considered the first article about acupuncture in the United States. Acupuncture is actually practiced all over the U.S., although it's interesting. Florida has the second largest number of acupuncturists in the U.S. Of course, California has the most. They have almost 7,000. Florida has 1,800. We're number 2. New York has 1,700. They're number 3. So that just kind of gives you a kind of an overview. A lot of MDs, there's 4,000 MDs who include it. The American Medical Association still, there's more and more studies. The trouble is it's really hard to provide the statistics that normally work because you can't really, you either stick a needle in somebody or you don't. So it makes it hard for them to have comparisons for things. Here's my Yin Yang picture that I was talking about a while ago, about how that's the goal of balance. That's actually a Tai Chi symbol because of the symbols around the Yin Yang symbol. Yin is considered dark, passive, feminine, cold, heavy, damp. Yang is considered light, active, male. Again, this was all written by men, ladies. But by the same token, they realized you couldn't have one without the other. You can't have male without female. You can't have light without dark. You need to have a balance of both. I think I've covered all this. But here's I was trying to get to this. This is a picture of those elements that I was talking about. So like I said, they support one another in this way, and then they control in the other thing. So that kind of gives you, there's people who will have like a wood personality. Everybody's seen a wood personality. That's the guy that shows up. He's got a big red nose. He's loud. He talks all the time. He talks over everyone else. He usually wants to tell you his opinion and is very aggressive about telling you. That's a wood personality. Again, his main drive is anger. A heart personality would be somebody who typically is very happy. They smile a lot. They have a lot of joy, but by the same token, they could easily drift off into despair. It doesn't take much for them to be unhappy. I think I've covered all this.
Is there somewhere we could read about all of that you were just talking about, the different personalities? And
There's a really good book. It's called Between Heaven and Earth. It's been out for 30 years. And I can't come up with the name of the authors to save me, but it was one of the first books that I read after I started going to school. She spends the first half of the book talking about these different personalities and how those personalities interact with other people. And the second half of the book is a cookbook. And it talks about different foods and soups and things that you can have that will help those kinds of personalities. So it's a really good book. But like I said, it's been out for 30, 40 years. I've lost track of where I was at. Let's start here. I didn't spend very much time talking about the channels or meridians, and I've got some pictures to go along with this which may or may not help. Like I said, the Chinese term Jinglo means channels, conduits, meridians. That's why meridians and channels are kind of an interchangeable term. It's kind of like the word qi, which is the perception of energy. But truthfully, in China, there is no translation for qi. I use the word energy. Other people use different words. There is no word that actually covers that. But the premise is that your energy flows through your body. There's 12 regular channels. 6 are yin, 6 are yang. Again, we're going for balance. I kind of talked about this, how they are named after the organs. There's also 8 what they call extraordinary channels that hold extra energy, hold blood. I think my next picture, yeah, here we go. Okay, this is a picture of the channels on the outside of the body. Again, these channels travel in and out and in and out. Now, the Chinese perception of where our energy comes from, and I tell this story a lot, is that where we as a person originate is when our parents get together, what they make is a fire. And then that fire becomes a baby. So the perception is that we all carry a fire around that we got from our parents. And the area where we carry that fire is in our low back, in the kidney area. So the perception is any, your congenital energy level or your congenital way your body is you got from your parents is stored in your kidneys. And of course that is not really changeable. However you are, if you're a big, strong, aggressive person, your parents probably were. If you're a small, quiet person, your parents probably were. So that's where you start. And then the basis for treatment is then that energy flows from those kidneys, which again, your congenital energy, that your fire you got from your parents, the goal is for you to feed that with food and water and air and your personality and make it grow into a grown-up where then you have that energy that you could then pass on to your babies. So when I describe this to people when they come and have acupuncture, I actually describe it based on it starting in the kidneys and traveling through the body from the kidneys up and around this way. But the truth is that's not really how it travels. Where it starts is it starts right here in the lung channel, which the lung channel starts here and runs down your arm to your thumb. It then goes into your hand where the large intestine channel starts on your first finger and goes back up. So each one of those then are all connected in and out and in and out. So there aren't any organs that are out there floating around that aren't connected to the other organs. And sometimes that's important because depending on what's going on with you, typically physical pain, it's pretty straightforward. You can place the needles. I almost never place needles where you hurt because we already know that the energy's clogged up there. That's why you're having pain there. So what I wanted to do is make that energy move. So based on what channel and what personality you are, where that energy is, then I might place the needle. Gallbladder channel is a good one. Gallbladder channel starts in the corner of your eye and it runs along your head and then it runs all the way down the side of your body and ends at your second toe or next to your little toe. So if you had a headache or a toothache, then I might want to put the needles in your foot so that I could pull that energy out of here, because we already know it's all clogged up here. So that would be a method to get it to move through your body. So sometimes that's the basis for treatment. And some of that is from years and years of the Chinese sitting around poking people and saying, oh, how does that feel? And sometimes it's from my own personal experience. But there is a basis for determining where to put the needles. But there's about 400 regular points on the body. One of the things that I have learned and I've really enjoyed is those points, even though you can't find them when you do an x-ray or you do an MRI, they really truly exist. And my perception is they're right underneath the skin. And the reason why I know this is when I put a needle in, it drops in. It's like the body reaches up and pulls it in. I don't predetermine the depth the needle's going to go in. Sometimes the body will pull the whole needle in. Sometimes it'll pull it in just a little bit. But all I've done is clear the skin. And then the body is really in control of the needle. So it's a very cool thing to watch. When it happens, the person will say, oh, I didn't feel that at all. So it really is significant. When that happens, I get a really good treatment. People feel great. Which, by the way, the side effects to acupuncture is you're calmer, you sleep better. So, unlike drugs and all those other things. Now, like I said, there's about 400 points just in the body alone. Now, I also brought some more stuff I want to talk about. Do you know what a biological hologram is? You know what a hologram is? Everybody's seen Star Wars, Princess Leia, three-dimensional picture. Okay. So a biological hologram is a three-dimensional picture of your whole body on a body part. That's how reflexology works. They see your whole body in the bottom of your foot. Chinese medicine, we see your whole body in your ear. It's like an upside-down baby. So for some things, the stimulation in the ear is much stronger than it is for the whole body. And what Jerry was talking about, the acupuncture that the military are now promoting, which is called battlefield acupuncture, is almost exclusively in the ear. And what they've found is by stimulating different points in the ear, they can actually cause the same effect as morphine. And that's a big problem, because out on the field, that's one of the things that they've run into, is the medic shows up to treat somebody who's obviously been hurt really bad, and he opens his box and somebody's stolen the morphine. Because morphine's a commodity, you know. Besides the people who just like it, they could sell it. So it disappears. But with the acupuncture, they can go ahead and treat those people and get them comfortable enough to then be able to transport them without the morphine. So it's really a really big and important thing that they've been able to learn to do that. So yes, the military are spending a lot of time and money on teaching people how to do that, so medics can show up and help someone immediately to relieve pain. Now, in the big picture of things, they're still going to need whatever Western medicine, because they've obviously been hurt more than that. Now, acupuncture as a method of treatment, as you realize, in China, that's the standard of care. In China, if you went to the doctor, you would almost always get acupuncture. And then, depending on what else was going on, they might refer you to a Western medicine doctor, or they might not. One of the advantages that I have, and I've been able to use, is based on my Western medicine background. Sometimes when you show up to see me, I'm not your best choice. You know, if you come and see me for bone spurs, I have a protocol for fixing bone spurs. It takes about 3 years. So I don't recommend that. I say maybe you ought to go see your Western medicine doctor and have him, fix your bone spurs. So it's not for everything, but it does work very well for a group of things, particularly pain. It's the best for pain. There's no side effects. There's no downside. And 80% of the people I see, they have significant relief, even the first time, over a period of time. But there's other things that I see people for. Mental and psychological things, sleep apnea, shingles, some of those things. I see some PTSD guys, And it's pretty interesting because when I look at their tongue and take their pulses and they look at me and say, no, I'm fine. No, I'm not angry about anything. No, I'm just here because my wife made me come. You know, I mean, that's really why they're there. But the truth is by looking at their tongue and feeling their pulses, I know that they are really, really, really angry. Now, one of the interesting things about Chinese culture is it's about the group. That's their society. It's all about the group. They recognize that individuals have emotions, but the truth is they don't care. They want you to go back to work. It's about the group. So they don't spend a lot of time on psychology at all. The goal is to get you back to work as a group. So they literally have discovered methods to use acupuncture to release things like anger, so that I can vent anger from somebody's body. And of course that won't solve all the problems that people have in life, but it gives them an opportunity to refocus. For PTSD guys, it works really well. Typically I put a lot of needles in their ears when I do that. So that is another method of treatment. I think that says that. The same points over 5,000 years. You were talking about acupuncture for football players. About 3 weeks ago, they had the Florida State Oriental Medicine Association meeting. And one of the speakers there, a guy named Robert Chu, who is from California, of course, and he's really famous. And one of the things that he does is he's one of the acupuncturists for the Olympics. And he was the acupuncturist for the Olympics for 2012 and for 2008. And so when the Olympic village sets up, one of the things that they have is they have at least one acupuncturist for the U.S. And of course China brings their own group, usually Korea, Vietnam, they have their own group. But he was telling this story, and I just enjoyed it so much. He said one day he ended up in the tent, you know, the first aid tent. Normally they have an orthopedic doctor, a DO, some nurses, some physical therapists, some massage therapists, everybody kind of waiting if anybody needs anything. And he said it just turned out it was a really slow day and everybody went to lunch except for him. So he said one of the runners came in and said, so is there a doctor here? And he said, no doctor. He said, how about a physical therapist? He said, no physical therapist. And he said, a nurse? He said, no. And he said, well, I pulled my hamstring and it's killing me. And he said, I just don't know what to do. And Robert said, well, I'm the acupuncturist. I can help you. And he said, oh, no, you're not sticking no needles in my leg. You know, I'm a runner. This is what I do. You can't be sticking needles. And Robert said, well, I don't want to stick any needles in your leg, but I think I could help you with that pain. And he said, well, you know, it hurts so bad, and fine, I'll just let you. So Robert put 3 needles in his ear. And he said, whoa, wait a minute, my pain's gone. He said, is it going to come back when you take the needles out? And he said, no. He said, so by that time, people are drifting in, coming back from lunch. And so this guy's walking around saying, look at my ear, look, my hamstring doesn't hurt, look at my ear. So, those are the kind of things that acupuncture helps with a lot. The needles. We need to talk about the needles. I didn't bring any needles. I don't ever bring any. I tried once to bring needles. I had them in a thing so that people could look at them. Invariably, by the time they got around the room, people had them out and were sticking each other with them. So you just can't do it. I worked for an anesthesia group for a while. And if you've ever been to the hospital, especially if you go to the emergency room, and you have something bad going on and they need to start an IV, you know, the nurse comes in and tries to start the IV. If that doesn't work, she gets her friend to come in and try to start the IV. If that doesn't work, she gets the supervisor to come in and try to start the IV. Then they call anesthesia. Well, guess who they sent down to start the IV then? So when I showed up, you'd been stuck 12 times. Whatever your emergency, it's a lot worse now, and you're really mad. So I was the person who would then come to start your IV. And I'm pretty good at IVs, but the truth is it still hurts. You know, I tell you to hold your breath, I told you to breathe, I tell you to do all this stuff. I get the IV in, but we have literally tortured you for however long. And in Western medicine, we teach you to suck it up, and that's what it takes, you know. Acupuncture is different. The needles are very small. In fact, most of them are smaller than your hair. They literally come with a plastic tube to hold them straight, because otherwise when I try to stick them in the skin, they curl up like hairs. Because our goal is not to make a big hole in you, and it is not to torture you. Western medicine, that's the way it works. Chinese medicine, we're looking for that balance. We're looking for things to calm you down. So the needles are teeny tiny. I have never had anybody say, oh my God, that hurts so much I can't do it. Never had that. Sometimes you do feel the needle going in. Most of the time, that's the only sensation you have. After that, you get warm, you get relaxed. I have a lot of people go to sleep. When I get acupuncture, I go to sleep. About 3 needles in, I am sound asleep. They have to wake me up, make me leave. A lot of the time when you come to see an acupuncturist is based, we spend a lot of time talking about where you live, how you live, what kind of things are going on in your life, how much you work, how much you, who you live with. We talk a lot about the imbalances. Again, I spend a lot of time on diet. I think that's the solution to a whole lot of problems. I think people can control their health to a great degree just by changing what they eat or don't eat. Of course, Chinese medicine, again, when they wrote all these books, people didn't eat fast food. So they don't spend as much focus on that as they do now, because we eat so poorly. We eat tons of chemicals that are bad for us, and then we wonder why we feel so bad. They also, again, look for this balance. So the perception that, you know, you got to work 60 hours a week, then you got to come home and run 3 miles, and then, you know, you got to hurry up and have sex because TV says you're supposed to have so many hours of sex. I mean, everybody's working at this high speed trying to accomplish all these things that we've seen on TV. We got to do, we got to do, we got to do. And the truth is we're using up all of this precious energy that we have. If you read one of the books, and again, the Chinese wrote 1 million books. 1 million books. There's a book about how to balance your life and not have too much work. And they have the rule about sex, which, of course, I remembered that. You know, everybody. For women, they say at 14, you reach sexual maturity. So you can start reproducing. At 28, you really should be done reproducing. And at 49, you need to stop having sex because you're wasting your energy. Now for men, they don't mature until they're 16. And then they're 32 when they've reached their maturity. And they get to have sex until they're 64. But at 64, that's it. No more sex. And they, you know, I mean, that was the standard. Was that at that point you needed to store all of your energy in you because you were going to need it to live for the next 30, 40 years. This kind of talks about, again, if the energy's stopped up, one of the things we're going to try to do is open it up. Sometimes the perception is it's cold or it's hot. If it's weak, sometimes it's just because you have used up all of your energy doing all these other things. And that emotion that's causing you to have, you know, one of the most common ones, especially for women, is pain in your shoulders and neck. They actually have a point on the top of your shoulders. It's called the weight of the world point. How many women are, you know, I mean, so we carry that. We don't eat enough. We don't take good care of ourselves. We're busy taking care of other people. And then you come and say, I can't turn my head anymore, and I don't know what caused it. Sometimes that's the real reason. This is from the book that I talked about, the Nanqing, when Huangdi, the emperor, the Yellow Emperor, was describing how the organs worked. And again, this was based on observation. It wasn't based on any kind of dissection. He said that the heart is the king who rules over all the organs of the body. The lungs are his executive who carry out his orders. The liver is his commandant, who keeps up the discipline, the gallbladder, his attorney general, and the spleen, his steward, who supervises all 5 tastes. So that was their perception of how the organs worked. Now, what I did was I put the Chinese word for heart, because when I talk about a heart condition in Chinese medicine, it is not the same as coronary artery disease or some heart condition in Western medicine. So I left the word for heart, which I'm tone deaf, and I was telling Jerry, when we learned Chinese words, they have a language which is kind of the universal language, which is written in Arabic characters, and they call that lost that word too. Yeah, but those words were words that we could read then without having to be able to read Chinese characters. But because I'm tone deaf, I would spell everything. The girl that sat beside me told me that I spoke Chinese the way Bugs Bunny speaks French. So, like Shin, which is the way I would pronounce that, may or may not be correct, was the word for heart. They perceived that the heart keeps the mind, that all our thoughts came from our heart. It didn't come from our head. They really seen the brain as a storage facility, not a place for making decisions. That the heart was where we made our decisions. It was also where we remembered things. So if we were having a heart condition in Chinese medicine, you would have insomnia. You would have palpitations. You would have things that would have difficulty remembering things. Dementia would be a heart condition in Chinese medicine. The emotion that goes with heart is joy. So, somebody who's really healthy and has a good heart would be somebody who's happy. Now, the downside would be that if your heart energy wasn't good enough, you would have sorrow. They call it the excess unceasing laughter, which really kind of translates to hysteria, would be considered a heart condition in Chinese medicine. The gallbladder, or the liver, which is called gan, is again, and this is really interesting, their perception of how our organs worked, and again, way before we could look inside the body, was they perceived that at night when you go to bed, all the blood in your body goes back to your liver. And so does your spirit. So if you went to bed angry, then there was not room for your spirit to get into the liver. So it would wander around all night. And it doesn't like wandering around all night, so it would come and kick you. And you would have bad dreams. And that would be the reason, is because you went to bed angry, so there was not enough room for your blood and your spirit to get back into your liver. Again, the perception is that the liver controlled the flow of blood, because all the blood had to go to the liver before it could flow out to the rest of the body. When it didn't work, irritability, mental depression, anorexia, abdominal distension. So some of the symptoms were very similar. It also controls a type of body fluid that affects muscle tone. So convulsions, twitching, spasms would be considered a liver condition also. They also assign different organs to, or different orifices to different organs. So the eye is assigned to the liver. Like I said, somebody who was a liver personality would have red eyes, or they would have trouble with their eyes. They would have vision problems or pain in their eyes. Because the liver worked with the heart, a lot of the emotions that would be associated with that would be considered either a heart or a liver. Like I said, they called it the soul or the spirit, but they perceived that it was stored in the liver, and that when you were angry, there was not enough room for it to go into the liver. They've seen spleen as the digestive organ instead of the stomach. They've really seen the stomach as just a hollow holding cell, but that the spleen would literally Once you ate something, the spleen would then distribute it based on need. So if you were having trouble breathing, then the spleen would send some of the energy up to your lungs, or it would send it to your muscles, or it would send it to your bones. And whatever was left over, it would send on down to the intestines or the bladder, whichever, to get rid of. So that was the spleen's job. Now the trouble with that is when the spleen isn't working well, those things don't get distributed. And so what you would end up with is you would hold extra fluid, or you would hold extra food. You'd have that feeling of having swallowed a brick and have a lot of indigestion. Of course, we know that the spleen actually does help with circulation and clotting and stuff, but their perception was that the spleen controlled the blood going around, and if the spleen wasn't working right, that's when you would have bruising or bleeding or that sort of thing, and that the spleen also controlled the muscles. Again, if your spleen was working well, you'd have a good appetite, you'd eat well, you'd feel better. It also is reflected in the lips. And the emotion that goes with spleen, with spleen and stomach, is depression. Lung, of course, does what we actually perceive lung to do. But like I said, it works with the spleen, so the spleen would actually move the air up rather than coming in from outside. The spleen would move the energy up to the lung for it to pull the air in, which is a little different from the reality of it. But the emotion that goes with spleen is, or with lung, is grief. And one of the things that I have found interesting about that is people, especially adult onset asthma, almost always those people will say, I got asthma right after my mother died. Or we had this car wreck, and ever since then I've had asthma. I mean, there's almost always a grief-producing history that that they will tell you about, that after that they begin to have breathing problems. The lung also is in charge of the skin, hair, that sort of thing. So when you're not breathing well, your skin will dry up, you'll have more wrinkles, your hair will fall out. That's all considered a lung condition. And again, a lot of times you can directly relate that to grief-producing situations. Got ahead of myself again. Kidney, of course, again, the perception is kidney is where we get our congenital energy, so it controls growth, it controls reproduction, because once we become adults and have developed our energy to that degree, then we can pass that on to our babies. The kidneys also control bone marrow, which, again, they've seen the brain as kind of a bigger bone with more marrow. They really seen it as a storage facility. They did not see that as where we controlled thought. But symptoms of a kidney condition would be dizziness, ringing in the ears, insomnia. Kidney controls the bones. And of course, it controls water metabolism, which is actually something that we perceive in Western medicine. The kidneys are seen as, again, the energy that causes us to take in air. And the emotion that goes with kidney is fear. And we all kind of know about that. If you get really scared, you'll pee on yourself. I mean, that's, But what I find is again, when I look at people's tongue, and if you've still got that thing passing around, I'm surprised at the people who come and see me who have fear. And if you say, are you afraid of something? You know what? No, I'm not. But they're living with this fear. They've been living with it so long that they don't even recognize it as fear anymore. And a lot of times, by this time, they're beginning to display symptoms. A back pain that won't go away. Their legs are weak. They have trouble getting up in the morning and getting started. They don't want to face the day. A lot of those things all have to do with emotional components that they've carried around for so long that it's affecting them physically. So, again, as the goal is always for balance, and unfortunately in our society we're always trying to get more and more and more. But this is an example of the things that in excess are not necessarily beneficial for us. So I kind of described what would happen when you come to see me. Again, I'll ask a lot of personal questions. I want to know how well you sleep. I want to know when you go to the bathroom. I want to know how often you eat, whether you stand up and eat, which is really bad, whether you sit in front of the TV and eat, do you cook your own meals to somebody else, those kind of things. I'm going to look at your tongue. I want to feel your pulses and talk about what I perceive going on with you. At that point, typically I have people sit in a chair. They are, especially the first time they come, because they're all freaked out about the needles, and laying on the table kind of contributes to that. So sitting in a nice recliner kind of helps with that. Like I said, I've never had anybody say, oh man, that just is too painful. I just can't deal with it. Once the needles are in, you relax. You're very calm. Most people, if they don't doze off, they still are very, very relaxed. About 15, 20 minutes, I take the needles out. But what's interesting is when those needles are in and I'm affecting that energy, I'm using your energy. I always make everyone eat before they come see me. Again, as a society, we don't correlate eating with energy. We don't realize that when we get up in the morning and we've got 400 things to do, and our decision to not eat breakfast is a bad one, because we need to feed our bodies, and we need to feed them when we need energy instead of feeding them at night with pizza in front of the TV. That's not the time to eat. You need to eat in the morning because you're going to do things all day. So you need to feed your body and have energy to go do the things that you need to do. And like I said, as a society, we've lost track of how food makes us feel. So we don't correlate any of those things. We don't correlate that we had pizza and beer at 9 o'clock at night and we're up at midnight with indigestion and we don't know what caused it. Or we're taking 14 of those over-the-counter indigestion pills and saying, you know, I just start having indigestion all the time and I don't know what it has to do with. We just don't, as a society, correlate what we eat with what is happening. But anyhow, when I make appointments, I always remind people to eat when they come. They are surprised at how tired they are after a treatment. Again, it appears very passive, but the truth is when I place those needles, I'm affecting your energy. Sometimes for the very first time. Sometimes some of that energy has never been utilized because we don't know how to control those things. There's some other things that I offer. Moxibustion, which is bunches of dried herbs. The dried herb itself is called mugwort. Typically they kind of look like a cigar. I literally want the smoke from that to be absorbed. The trouble is it kind of smells like marijuana, so I have trouble getting to do that in the office. It freaks everybody out, you know. It says incense-like. That's not what it smells like. Electrical acupuncture. Jerry and I were talking about that earlier, and using electrical acupuncture. How that came about was in China, they got a lot of people. So a lot of things that are very labor-intensive that we kind of take for granted, they have people who do that. And one of the things that they discovered is if they couldn't get the energy to flow well, if somebody would take the needle in and out, that would stimulate the energy to flow. And in China, they have people who take it in and out really, really fast. That's Most people here can't do that. So we've discovered that by applying just a tiny bit of electricity, we can stimulate that same sensation and therefore affect the energy that way. So that's typically what we use electrical for. I use that a lot for people who have muscle spasms or for a major muscle injury. That helps stimulate a big bunch of energy to go through that area. I wouldn't do that to somebody who wasn't, in really good physical shape, because again, I would use up a whole lot of your energy really, really quick. I thought I'd talk about a couple of conditions in Chinese medicine, just to kind of give you a perception of what a Chinese medicine diagnosis would be. So, spleen qi deficiency is one that's very, very common. As Americans, probably 80% of the people sitting here meet the criteria to have spleen qi deficiency, along with some other things. Either no or poor appetite, have abdominal distension after you eat, you're tired, you're weak, you have a sallow complexion, diarrhea, nausea, stuffiness of the chest and epigastrum, a feeling of heaviness in the head and limbs. Now, you wouldn't have all of those. But again, you can visualize this person. They're a little heavy. They tell you they eat a lot of salad, and they probably do eat a lot of salad. They don't have any energy. They don't know why. They're tired all the time. They just don't feel like they can do anything. When you say, well, maybe you ought to do this and this, they have no desire to do those things. It's like, I just can't. I just can't make myself get up. I can't do this. I feel tired all the time. I keep eating all this stuff. It doesn't make me feel better. Typically, like most Americans, they're working way too much. They don't spend enough time relaxing. It's one of the things that they talk about a lot, and we do it. We eat in our car. We eat standing at the counter watching TV. How many people this morning, when they got ready to leave, was standing there watching TV and eating and drinking a cup of coffee? I mean, we do it all the time. But that's not how we digest food. I mean, we're not enjoying our meal. We're stuffing food in our face that we don't know how it's going to make us feel, but we know we ought to eat something. So you got your Egg McMuffin, your cup of coffee, you're driving down the road, you're talking to your sister-in-law on the phone and listening to the radio on your way to work, where you're going to be 5 minutes late and the boss is going to be standing there doing this, and all that stuff you just ate just turned over. You feel like you weigh 400 pounds. You feel like you don't have any energy to do anything. You don't have any desire to do anything. You want to go home, lay in front of the TV. You just have no motivation to do anything else. That's spleen qi deficiency. We're kind of in a damp area, but it's not really typically in and of itself the damp energy or weather is not. But you know how if we have a period where it rains for days and days and days and everything just seems a little soggy, we all kind of feel a little heavier, a little less inclined to do things. So, what would you do to treat that? Well, first off, you'd stop eating raw food. The Chinese perception is when we eat, we cook our food. Now, to some degree, that's true. The hydrochloric acid in our stomach breaks down food, and that's where we get our energy. But they say that actually heats up the food so that you can get the most energy. But we don't do that. We eat this big salad. It starts heating up. We pour iced tea on it. Cools it down. Got to start all over again. So every time it gets heated up, we pour more iced tea on it. By the time you get the food digested, you've used up all the energy you might have got from the food. And all that's left is whatever excess the body can take from that, which is stores as fat. So we don't get any real nutrition from that. And we've used up all our energy, so we didn't gain anything from the meal. Now, that's not to say that you shouldn't eat raw foods, but what you need is a balance. If you go to Europe, any place in Europe, there is no ice water. Most countries don't drink ice water at all. One of the reasons is because room temperature or warmer water aids with digestion. So when they offer you soup and salad, there really is a reason for that. You're supposed to have the warm food with the cold food to balance that out. Unfortunately, as Americans, we've skipped the salad. We're just going to eat or skip the soup. We're just going to eat the salad. We're going to have iced tea with it, and we're going to drive to work while we're eating it. And then we wonder why our stomach hurts, and why we're tired, and why we don't have any energy. So, at least part of the solution is, and again, virtually no dairy products, but boiled foods, hot foods, soups really make a huge difference. Onions, garlic, we get a lot of nutrients from those that we can absorb immediately. They help with energy. Of course, lots and lots of vegetables. Not so much meat, but even fruit, heated up just a little bit, will give you much more value than eating an apple and drinking a Dr. Pepper. It really makes a significant difference in your energy level. And this is one of the things that I try really hard to teach my patients. And it's amazing how much better they feel as we begin to change their diet away from the pizza and beer and to the soups and to warm foods and to having warm drinks with their meals. It makes a huge, huge difference. And again, not eating in the car, not eating standing at the counter, to physically sit down and acknowledge this is what we're doing, is we're going to sit down and eat. Makes a huge, huge difference. It makes a difference in your whole state of mind. I mean, think about the times that you sat down to dinner with the family, no one was in a hurry, and you got to eat the meal. Wasn't that so much better? I mean, didn't you feel better afterwards? Unfortunately, in today's society, how often does that happen? But as adults, we have some control over when we can eat and the things that we're eating. Like I said, I try to stay away from raw foods. Especially someone who comes to me who meets all the criteria. Most of us in our society have some of these symptoms for spleen qi deficiency. I don't see a whole lot of people who have all of them. But if somebody really did have all of them, that would be the first thing I'd do, is say no more salad, no more raw food of any kind, no more dairy products, only warm foods, only cooked foods, not in front of the TV, especially not watching the news, and not arguing with your husband while you're doing it. It seems to be harder than it sounds, so. Ginger. I'm going to talk a little bit about this. As a licensed herbist, I do prescribe herbs. Not very often. But I have to tell you, one of my pet peeves is people will come to me and list off the 42 individual herbs that they're taking that they bought at the store. The whole basis for all of Chinese medicine is balance. So when I prescribe an herbal prescription, I do not prescribe a prescription that's just got one herb in it. Again, it's all about balance. And the qualities, herbs are assigned qualities. They're either hot or cold, they're pungent, sour, sweet. So when you make an herbal prescription, you don't want to just give somebody ginseng, which ginseng's a very hot herb. So all those people come to me and say, you know, I took that ginseng, I've been taking that for 2 weeks, man, I've been working out, but my stomach is killing me. And I've been constipated, and I notice that I don't pee very much. Well, that's because ginseng is so hot, it's heating up their whole body, and they've not correlated that. If I was going to give them something to help build up their energy with some ginseng, then I would add some cool herbs to that to help balance it out. And I probably would add just a little bit of some sweet herbs too to help smooth that out entirely. So when people take those individual herbs, they're not getting the benefit from them because there is no balance. Ginseng, like I said, is a big pet peeve of mine because I get a lot of people who are taking 2 or 3 different kinds of ginseng. And then they come see me and they say, you know, my blood pressure's been real low. I just don't have any energy. My skin's all dried up. The ginseng's doing all that. Ginger is one of the few herbs that is an exception in that small quantities, ginger tea. You can add ginger to your food. It's a warm herb. It's not a hot one. It helps with digestion. It helps smooth out when your stomach's kind of upset. It's a good one for that. Cinnamon bark. Cinnamon is a warm herb also. You have to be careful with it. You can take too much of it also. They see chicken eggs as a cool component. So in China, if you were going to eat eggs, you would have either some ginger tea or you would have a warm tea to go with it because it's considered cool. Celery's cool. So if you were going to eat a salad with a lot of celery, then you would want to have a ginger soup to go with that to help balance that out. These are the acupuncture points where I would actually put the needles. And I've got some pictures. I don't know if you all will be able to see those or not. But these are specific places along the different channels that would help straighten out your energy so that you would feel better. I don't know if you can see any of those. These are kind of mid-back, mid-front. Oh, it's mid-front, so right in here. I'm sorry, they're not very good. There's a point on your leg, which, when I talk about all these books, there's a point on your leg that literally there's 54 books written about the one point. And it's right below your kneecap, just to the right of that bone, right down the middle of the front of your leg. A lot of people, when they have stomach problems, can feel that and it'll be sore. If when you feel that and it's sore, if you'll massage it a little bit, you'll find your stomach feels better. That point's called stomach 36. And like I said, there's 54 books written about it. I have not read all of them. Some other points down on your foot, along the side of your big toe. Those are just not good pictures. I'm just about out of time. I was going to talk about liver fire, but I'm afraid we've run out of time. Can I answer any questions? Do we have time for questions? Yes, ma'am.
What is the name of that book you suggested?
Between Heaven and Earth.
Between Heaven and Earth. The other question, how many quarts of blood is in your body? And how do they know how long it would be recouped before they say you can get back to square one after you give blood? How long does that take? How many quarts of blood in your body?
I think there's 8.
That's what most people do. And then how long does it take to recoup when you do give blood?
It depends on what you eat, what you drink, and what you do.
A couple of days, a week?
Sometimes a couple of days, depending on what else is going on with you. It could take as long as a week.
Okay.
It depends on your physical condition.
Okay.
Yes, ma'am.
If somebody wanted to come see you, you have an office in Mary Esther and one in Navarre. How long would the appointment be, and what is the cost? And is any of this covered by insurance or?
I'm a Blue Cross Blue Shield provider, but they won't actually pay me. And none of the others would even let me do it. So if you have Blue Cross and Blue Shield, they will reimburse you after you see me for some amount. It's different for, like federal, sometimes they give 70% for other groups. So really, the truth is Medicare, TRICARE won't pay me anything at all. So for the most part, it's really not.
And what is your fee, and how long is the appointment usually?
Usually, the first one at least, you're there for about an hour because I want to ask you all those questions, and I usually explain all this stuff again. And I charge $75 for a session. So.
And after that initial session?
No, I charge the same. And then after that, as far as time, typically it's 30 minutes. You know, we don't spend as much time talking, but and more time on the treatment. Do you have?
On the Blue Cross, if Medicare doesn't pay, then they won't pay.
Right. If Medicare is your primary, Blue Cross won't pay. Some people have a different kind of supplement, and sometimes they'll pay, but they're not paying very much. So the truth is insurance doesn't help you very much at all on that.
I want to thank Dr. Roe for giving this presentation. I learned an awful lot in this, and I want to say one thing. I got into acupuncture through the back door through martial arts, and I think I mentioned that before. And I quickly realized that I would never become an acupuncturist because it requires a great deal of training. And there are so many points, these 400 points. But I do have something that if any of you out there want any information about books on acupuncture or that Between Heaven and Earth, it's in my library. And if you have my email address, I'll share with you. I have a ton of books on acupuncture in my Kindle and a lot of the charts.
Oh, good.
Yeah, and I will be glad to share the list with you if you're really interested in that.
I do. I have some brochures in the back. I have a website. I have email. You're all welcome to email me with any questions you have. I'll be glad to answer anything you want to know. I'm sorry I kind of went back and forth with the PowerPoint. I thought I had a plan and it didn't work out that way. But yeah, get a hold of me. I'll be glad to answer any questions that you have. And like I said, go to my website. It kind of gives you a little more information about some specific things. I've got some recipes on there for soups that I highly recommend. So thank you very much.
Thank you very much.
Okay.
Excellent presentation.
Thank you.
Really good.
That's so nice. Thank you.
Okay.
The training aids back here.